At home, Minister in the Prime Minister's office, Grace Fu, says even as the government is prepared to shoulder a larger share of healthcare costs, there's still a need for Singaporeans to continue making co-payments. She made this point at a dialogue session with Ang Mo Kio residents.
New hospitals.
Issues concerning healthcare dominated the 1.5-hour dialogue. Some wanted to know if more subsidies can be provided to help Singaporeans cope with rising medical costs.
We can say have a 20% subsidy or 80% subsidy, but if the total medical bill is very big, any small bit of, even a big percentage, is also come out a lot of money for the residents.
Ms. Fu said that the issue of healthcare costs has been a common concern among Singaporeans, but she assured that no matter what their income level is, no one will be deprived of good quality healthcare.
Ms. Fu noted that compared to other countries like Malaysia, Singapore's healthcare costs can be higher. One reason is due to drug companies charging different countries different prices. She said the government is trying to reduce costs by bulk purchasing items and is reviewing the various financing models. But it can't put in place schemes like those in Europe where there is no co-payment.
With a very aging population that we're anticipating, the cost of supporting that system actually will fall on our children. They have to support us with their taxes. So we have to make sure that we don't go down the route of some of the countries or nations that we see are now having great difficulties supporting such a social security system. Second point, so it's some co-payment, some responsibility on our own self that we keep ourselves healthy.
The idea of self-reliance is also something that the Programme for Resident Estate Service and Support is pushing for among residents of Ang Mo Kio. It's targeted at those who have accumulated more than 6 months of arrears for their service and conservancy charges.
So what they do is they're given some sort of a temporary job by Town Council and CDC to go around and check the lightings, check some amenities around the estate, and they are paid about $300 a month, and 60% of that will go into the payment of their arrears, while 40% will be given to them in cash.
Ms. Fu also visited households who have benefited from the government's home improvement program. Residents co-pay a certain amount to have their aging flats improved with better facilities such as upgraded toilets.